When infection control is crucial, water quality can't be left to chance. Aquamedics delivers proven protection with innovative point-of-use and inline water filtration systems trusted by hospitals and healthcare facilities nationwide. Aquamedics filters use advanced fiber membrane technology with 0.2 micron pores to block Legionella, Pseudomonas, and other dangerous bacteria right at the faucet, shower head, or ice machine. Whether you're responding to a waterborne outbreak or building a proactive water management plan, Aquamedics has the solution to safeguard your most vulnerable populations without chemicals, disruption, or delay. All Aquamedics filters are ASTM F838 tested and available for rapid deployment so you can act fast when it matters most. Protect your facility, patients, and staff with Aquamedics. To find out more, go over to scalinguph2o.com/Aquamedics. Once again, that's scalinguph2o.com/Aquamedics. Aquamedics, your partner in waterborne infection prevention. Hey there, Scaling Up Nation. It's Trace Blackmore, and if there's one thing we know as water treaters, it's that success comes from building strong partnerships. And that's exactly what North Metal and Chemical Company is all about. My friends at North Metal are committed to creating long-term relationships built on trust, reliability, and innovation. Their industry-specific expertise means they understand your challenges and work tirelessly to provide great Northwest products along with a personal touch. With dedicated technical support, North Metal and Chemical Company stands out as a partner who truly cares about your success in the industrial water treatment space. Head over to scalinguph2o.com/north and start building a partnership you can count on. Once again, that's scalinguph2o.com/north. North Metal and Chemical Company, serving the water treatment industry since 1921. Welcome to the Scaling Up H2O Podcast, the podcast where we scale up on knowledge so we don't scale up our systems. I'm your host, Trace Blackmore, and we are in Legionella Awareness Month. We do this each and every August to make sure that you are challenging what it is that you know about Legionella and other waterborne pathogens. And we have heard from some tremendous guests during this month of August. And many of you have reached out to us to let us know how you are challenging the way that you are thinking about what you thought you already knew. And folks, that is the whole call to action this month, is to make sure that we are getting better information so we can have better conversations with our customers. Several of you have reached out to us and say you really enjoyed us having an encore episode with Patsy Root coming to join us last week and sharing some of the things that she knows about Legionella legislation and how we could get more up to date on what's going on with regulations in our country and around the world, and how do we look at what's going on in the entire global landscape to predict what's going to happen to us in our local landscape. Now, Patsy shared so much information with us last week. Legionella pneumophila is responsible for more than 90% of cases. So why are we looking for other things? That was a question that she posed last week. And she not only posed that question, she introduced me to a researcher that is trying to ask that very question. And we are going to hear from him today, and hopefully that's going to make you think about some of the things that we're doing in a different way, which will ultimately lead you to asking other questions. And when we as industrial water treaters are asking questions, when we're challenging things that we already know to figure out how we can make them better, folks, that does make it better. That raises the bar in the entire water treatment industry. And you, as the Scaling Up Nation, are doing that. So something that I want you to consider as you listen to all of this content during Legionella Awareness Month is how do I have better conversations with my customers, because they're ultimately the ones that need to make the decisions. And if they had better information, they can make better decisions. And if they are making better decisions, then all of us are doing what we can to protect health outcomes. Nation, I have no doubt that we are getting better each and every episode, but don't leave it there. Don't let it die on the vine. Make sure that you are challenging everything that you think you know to make sure you know it the way that you should. Now, somebody that challenges us each and every week is our friend, James McDonald. And here is every water treater's favorite game show, What Do You Know?
Hello and welcome to What Do You Know? The game show where we find out what do you know about industrial water treatment, drop by drop. So pump up your brain, take out that test kit of knowledge, and prepare to answer this week's question on What Do You Know? Today's question is, what is it called when a valve is closed at the end of a pipeline system, causing a pressure wave to propagate in the pipe and a loud banging sound? Water hammer. It is also called hydraulic shock or fluid shock. It can not only be noisy and cause vibration, but can also lead to pipe rupture and collapse. I'm James McDonald, and thanks for playing along with us. Stay tuned for next week's episode of What Do You Know?
Well, thank you, James. And I hope every week you are challenging what do you know and making sure that you are challenging yourself each and every week, each and every segment. And it's my hope you challenge what you know each and every account. I know that a lot of people can become complacent and get bored when they do the same things over and over again. I hope whenever you service any account, you do at least one thing in a different way. That will challenge the way that you are doing things and make it more exciting. That will challenge the way that you are seeing things, and that will make it more entertaining for your brain because you're doing something a little bit different and you're going to have to think about it. And folks, when you do that, you're going to open up all these new brain cells and new possibilities. And if you're doing that, I don't think there's any way that you can get bored. You can bring your very own What Do You Know game show to each and every client, to each and every account, and just figure out, what do you know about that account? What can I do differently? I normally take my sample from this location. However, I'm going to take it from a different location. I normally run my test in a certain order, but you know what? I'm going to do that a little bit different and see if I can find something different. Now, most of us do testing based on efficiency, but let me tell you, if you do things the same all the time, every time, you can become complacent. So if you just run something, what does that something tell you? And then figure out what to run next and see if you can corroborate what it was that you thought you know. And that might be a fun exercise. Folks, you should never be bored in this industry because there's so much in this industry to learn about. And if you are bored, that is the turkey timer popping up saying that you are doing it wrong. So do something different. Try to do something that challenges the way you think. I read an article recently where they challenged people, if you brush your teeth with your right hand every day, try to do it with your left hand. Now, you're going to do it and you're going to realize how difficult that is, but that's actually teaching your brain to do a very familiar exercise in a different way. They actually say to do that to keep your brain sharp. And to do daily activity functions like that in a different way keeps the neural pathways functioning. And it's a good deterrent. They're trying to experiment with things like dementia. Well, I'm going to tell you to try to do things a little bit differently when you're servicing accounts, because it's going to keep things interesting because you're doing things differently. And that is a way that you're constantly learning. Well, Nation, another way to constantly learn is to put yourself in new situations. And some of the conferences that I think you need to know about is the WEFTEC 2025 conference taking place September 27th through October 4th. And this is a huge conference. WEFTEC is a huge supporter of this podcast. We share information. They are outstanding. And so many of you in the Scaling Up Nation are also WEFTEC attendees. So most likely you will see many people in the Scaling Up Nation there. Make sure you drop by, you say hi, maybe you tell each other what your favorite podcast is. Maybe you come up with an idea for what you want to hear on the next podcast. But you're not going to be able to do that if you don't attend the conference. And I know a lot of people hear me talk about conferences, and you might get a little bit nervous. Maybe you're more introverted, and that just stresses you out thinking about going to these conferences. Well, Nation, one of the reasons that I give out Scaling Up H2O buttons at conferences is so you can identify other Scaling Up Nation members and make it a little bit easier to introduce yourself, because now you have something in common that you can talk about. I've now broken the ice for you, so maybe you can meet somebody new. So when you're at these conferences, look for Scaling Up H2O buttons. If you have one, go ahead and bring it. And if you see me or somebody else at the Scaling Up H2O booth, if we have one, you can pick one up there and talk about, what are you doing at this conference? What are some of the papers that you're planning on attending? Maybe you can attend them together, or maybe you have a paper where you have two at the same time and you can't attend both, so you guys can divide and conquer. You met over the Scaling Up H2O podcast, and now you have somebody who's helping you with the conference. Another thing I love to do with people is hold each other accountable. What's the one thing that you're hoping to get out of this conference, or what is the one thing you got from this conference? And then go back and execute it. If you tell that to somebody that is also at the conference and you connect with them the next week after the conference, you can hold each other accountable to actually get that done. Trust me, things like that take a whole new dimension into going to conferences, because it's not just going to a conference, it's what you're going to do because you went to that conference. Well, another conference you might want to look into is the National Association of Water Companies, and that is taking place in Miami, Florida, September 29th through October 4th. We, of course, are going to have all the information about that show and every show that we know about by you going to scalinguph2o.com, going over to our events page. And folks, when I say we have everything up there, we have everything that we know about up there. But if you see something that should be up there that's not, let us know by going to our ideas page, and then we will definitely get that up there. Thank you for helping us make that page the one-stop shop for everything that is going on in the industrial water treatment industry. Well, Nation, not many episodes happen without me somewhere in the episode stating, I need your help. Who should I meet next? And what topics do you want me to talk about next? Well, that is exactly what happened with our next guest. Our previous guest last week, Patsy Root, introduced me to Dr. Spica. And folks, you are going to love this interview. Here it is. My lab partner today is Dr. Vincenzo Romano Spica, head of public health at the University of Rome, Foro Italico. Dr. Spica, welcome to the Scaling Up H2O podcast.
Hello, everybody. Thank you for giving me this opportunity to be here today.
We are so excited to talk to you today and want to thank our mutual friend, Patsy Root, for introducing us And Patsy was the one that sent me your paper. That was just fascinating. And I know the Scaling Up Nation is really going to enjoy our conversation today. But before we get there, do you mind introducing yourself to the Scaling Up Nation?
Oh, sure. I am actually an MD, and I specialized in medical genetics, but I always dedicated my research study work in applying new technologies to prevention and public health. So I have been actually also working in US for a while, in Frederick, Maryland, where still my heart is, with a lot of nice memories, and also in San Diego, the Scripps Institute for a while. Last time I was in US actually was 20 years ago in 2005. In the 1994, I came back in Italy, and I dedicated to hygiene and prevention. And in particular, I was in a huge hospital, big university hospital in Rome. And now I am in a state university, University of Rome for Italico, where in our lab we try to consider new technologies, and in particular from an epidemiological point of view, which means also using computer data analysis and not only the wet lab.
Dr. Spica, how did you get into studying Legionella?
Oh, Legionella was following me somehow. Actually, I didn't want, but my professor, who was a young researcher, proposed me to join this project. At the time, in the middle of the 90s, there was not so much interest and attention to Legionella yet. And I tried to avoid it, but he said it may be important, and I trusted him. And after that day, Legionella has been always coming with me. Actually, I participated in making a national working group in Italy to study the distribution and prevention of Legionella since the 90s. And then we have been applying different technologies, also molecular technologies, to try to better understand how to improve the detection of the microorganisms and try to explain why for some people it is so dangerous to become even lethal.
Dr. Spica, can you explain the significance of Legionnaires' disease as a public health issue over in Europe and specifically Italy?
Yes, Legionella is a very specific, a particular microorganism, and has a public health impact that is really important. The main reason is that even if the Legionnaires disease is a pneumonia, the way of transmission is not from person to person. It's not contagious. Sick people, at least from what we know so far, cannot transfer the disease to another person, but it comes from the environment, and in particular, it comes from water. Therefore, it is extremely important an approach that is based on environment and that is based on the management of water. And it can be prevented. So even one case should be avoided. And they can be avoided today because there are ways to monitor and surveil this kind of disease. But even if it is diffused almost in all European countries and in the different districts of Italy, as well as in all the countries all over the world, at least in Europe, the 75% of the cases are in Italy, France, Spain, Germany. And even if in Italy we pushed to address the aims of an advanced prevention system, still the cases are increasing. So it is challenging, and it is important also for another point of view, extremely relevant for public health, which are regulation. So there is a recent European regulation that is introducing Legionella as one of the markers to control. And whenever you have a law, the cases that you get somehow are against the law. So you have a duty as a public health officer or researcher or scientist to reduce those cases as much as possible. But Legionella is here much before than humans on the earth. So water is here. It's the main problem comes from buildings, from the use that civility makes of water. Therefore, once these microorganisms that stays in nature, in the water, arrives in our taps, in our buildings, it may become a risk for our health. And today we have all the instruments to prevent, reduce this disease. So it is extremely relevant for public health.
Now, you mentioned buildings. Your study focused on non-hospital priority buildings. What are those types of buildings, and why did you choose to focus on those?
Oh, that's a very key point, because we avoided the hospital buildings. Why? Because at the beginning of the story of any infectious disease, we have what we in epidemiology call a triangle. In this triangle, you have the environment, which is extremely important, is the basis. Then we have the etiologic agent, which is the microorganism, the pathogen. But then we have the host. And in buildings where you have a recovery of patients, in buildings as hospitals, you have a different kind of host, much more susceptible to diseases, infection. So those buildings have to be considered with a different care, with different tools. Instead, we decided to focus on all the other buildings where also there are regulations and there are indications to avoid people to get sick. But in the so-called community outbreaks or community cases, the situation is very different, because there can be people of different ages, but healthy, and they have all the natural tools, resistance and the immunological defenses to protect themselves. So the way how you have to focus the preventive action, it can be pretty different. And then there are several other issues, but I don't want to speak too much about that. What I would like to say is that even if you have a thermonuclear weapon against Legionella, you cannot use that in all cases, because you can make more damages than benefits. And then it is very expensive. So from a public health approach, especially when you watch at community, you have to find a kind of a compromise where you have a good price to use the best resources, to save as much as you can people, but also you do not want to take away resources from other preventive actions. So the cost of the action is very important, and on the community, it becomes a huge number of people. So it is extremely relevant to consider these other kind of buildings, and we wanted to focus on this.
Now, you study comparing all Legionella species versus just looking at Legionella pneumophila, and I think serogroup 1. Can you speak on that and what some of your findings were?
The point is that Legionella pneumophila is the pathogen originally discovered in 1976 in Philadelphia, where there was a terrible outbreaks, where there were army people, veterans, and so the name Legionnaires Disease. But then studying these microorganisms, studying water, several other cousins of these microorganisms, brothers actually and sisters of these microorganisms came out, and there are several other species. So a main point is we want to take out Legionella species, any kind of Legionella from all over our pipelines, buildings, and points where water is managed. That becomes very difficult. And the main question is, are also dangerous? So far, it is not exactly like that, because even today, the main responsible for death as well as diseases, Legionnaires disease, is Legionella pneumophila. But because prevention is on buildings, on water, if you focus also on the other species, you have to expand the action in different situations where we want to try to understand if the risk and the advantages were justified by the cost and the resources that are used. You have to think that even if up to 80%, 60% could even be a mixture of different kind of Legionellaceae, the cases are represented for over than 90%, actually 98, 97%, or even 100% in some studies in Italy, over 93% in studies in Denmark and other countries, are all due to Legionella pneumophila. So that is the main pathogen, and that is the main reason of most of the cases, even if other species definitely are present, and even if some strategies would suggest to consider all the different microorganisms of this group.
How did you account for potential underestimation of Legionnaires' disease cases in your model?
In Europe, as in US, and all over the world, it is also widely accepted that the true number of Legionnaires' disease cases is underestimated. The question is by how much it is likely underestimated. We are trying to still measure this phenomenon, but so far we were able to leverage data through a study by Cassini and other authors that was focused to European countries, including Italy, that was considering the quality of the different surveillance systems for Legionnaires as well as other diseases. Cassini calculated the underestimation of Legionnaires' disease cases in Italy to be between 0 and a maximum of 3.03. His calculation considered both under-ascertainment, meaning people who suffered from the disease but did not access the health system, and under-reporting, meaning those cases that were either not diagnosed or misdiagnosed, or were identified correctly, but then not reported to the national surveillance system. So we used the high end of the Cassini's range and multiplied the reported rate of Legionnaires' disease per 100,000 people in Italy by this value, which is 303. This is part of a general approach that we used in our study, because in our simulation, in this model, we wanted always to be very conservative. So we wanted to stress the system to try to demonstrate the opposite of the initial hypothesis. But even if we were very conservative, even if we stressed the system, and even if we used all the parameters, including this underestimation value, always the results that we got has been confirming the comparison between different strategies. And therefore, it has been very useful to take decisions in public health and for prevention of legionellosis.
And you also looked into the impact of the widespread use of the urine antigen diagnostic tests that are used to diagnose Legionnaires' disease. What were your findings on those?
Yes, that is a very important point, because the urine antigen test is one of those that are used, and it is focused on serogroup 1. But there are not only different species of Legionella, there are also different serogroups of Legionella pneumophila. So we did indeed dig in, and we, in our paper, we even added a supplemental section to get into this aspect. The urine antigen test is very diffused, and it is very important, but in this way, we could have missed all those cases due to other species of Legionella. So there are at least 15 other serogroups of Legionella pneumophila. And there are also those that are not pneumophila. So it is an heterogeneous population. And some of them have been involved in community-acquired outbreaks, including a big one right here also that happened also in Italy a couple of years ago. So when we did the literature review, and actually we fixed the results of the review in a database which is accessible through the published paper. I will provide you also the link if someone would be interested in going through it. When we made the review, I was struck by the fact that worldwide we are likely missing as many or more Legionnaires disease cases caused by those pneumophila serogroup 216, not one. Then we are missing cases from the other waterborne Legionella like other species. Some names are Anisa, the Micadei, and there are several others. So we examined for different data sets to test the hypothesis that a widespread UAT use leads to an overrepresentation of the percentage of community-acquired Legionnaires disease that is caused by pneumophila. And I lead with the headline, it doesn't. That 95% to 97% of all Legionnaires disease cases caused by Legionella pneumophila is confirmed that it may be a very robust number. Initially, we looked at a study analyzing 40 years and 23,000 clinical samples received by the New York State Department of Health between the end of the 70s and the 2017. In the study, the researchers compared the frequency of cases due to serogroup 1 and serogroup 215 and non-pneumophila before and after the widespread use of the urinary antigen test in diagnosis in New York, which started in about the 2000s. The data show that the percentage of cases from non-pneumophila species only went down a very little with the widespread use of UAT from 10.7% to 7%. And their data represents predominantly healthcare-related infections. The most susceptible patients or other diseases due to different Legionella species. Also, this study supports the conclusion we got, and the UAT use actually did not change the mix of total cases caused by Legionella pneumophila. So this is a first line of evidence. But then we also examined a 10-year data set from the European Center for Disease Control surveillance of Legionnaires disease across Europe. And we found that 95% and more of the Legionnaires disease cases were due to pneumophila. And the rate remained true regardless of whether the patient were initially diagnosed, identified with urinary antigen test or with more traditional methods as culture. Then there are other studies from France, Denmark that analyze this phenomenon. And again, the reliance on UAT and still show about 97% and 93% of their cases are caused by one of the pneumophila serogroups. So it is important then also to consider some data coming from immunological studies where healthy adults routinely exposed to non-pneumophila species develop antibodies, but because of the lower virulence probably never develop then the Legionnaires disease as a result of their exposure. On the contrary, even healthy population and do not have the antibodies for Legionella pneumophila, but with similar kind of exposures, they can get sick. So it is a complex question, and it involves several approaches, but at the end, even if the urinary antigen test is focused on a specific kind of Legionella, the pneumophila one, but the result, the approach would not have been a major bias in the starting population and numbers we consider to feed our model and to make the different simulations.
You also talk in your paper about the concept of disability-adjusted life years and how that applies to assessing the impact of Legionnaires' disease. Can you tell us a little bit about what that is and how you use that in your assessment?
That is a different way to measure the burden of disease. DALY stands for Disability-Adjusted Life Year. It's called DALY, DALY. And it is a different single metric by which you can compare the impact of different diseases. It is a tool that researchers, operators in public health officials can use in planning and in the prioritization of infectious disease prevention and the following actions. And also to improve preparedness and to set up the most appropriate control measures. DALYs are calculated based on the disease incidence, which are the number of new cases, and the risk of developing complications on the short or long terms, and the severity. In our paper, we used it to compare the disease burden of Legionella pneumophila monitoring and control approach to the burden of monitoring and control for a broader approach, including all the Legionella species. It turns out that even if cost of the two strategies are very different, because the species control is much more expensive, as shown by the model, different simulation. Finally, the estimated daily prevented per 100,000 population then are almost identical, which means much higher cost, even 40% more for the species approach, but then with an advantage that is very limited in terms of daily, in particular 3.77 dailies per 100,000 people prevented for the Legionella pneumophila approach, rather than 3.86 dailies for the wider approach focused on all the different species, including all the different species. So this concept of daily is another way to measure actually the same phenomenon.
Before we dive deeper into our interview, we're going to take a quick break to hear from one of our sponsors. Hey there, Scaling Up Nation. One of the biggest water treatment challenges in cooling water systems is biofilm. You know, that stubborn, slimy stuff that can wreak havoc on your operations. Our friends at AMSA have developed a line of biofilm control products that are specifically designed to tackle this problem head on. AMSA products are so much more than biofilm penetrants. They're engineered to go straight to the surface, penetrate deep into biofilm deposits, and break them apart. AMSA products work in all types of cooling water systems, and they're incredibly efficient. They can operate at low concentration levels, making them a cost-effective solution. Plus, they're easy to use, so you can integrate them seamlessly into your existing water treatment program. The bottom line is, biocides alone just aren't enough to control biofilm. That's why AMSA's specifically designed chemistry is the missing piece in your biofilm control strategy. It elevates your treatment program to a whole new level of effectiveness. So if you want to clean it up and keep it clean, head over to scalinguph2o.com/AMSA to learn more about their innovative biofilm control solutions. Once again, that's scalinguph2o.com/AMSA. Trust me, your cooling water systems will thank you. Let's jump back in right where we left off. Now, speaking of costs, you looked at both direct and indirect costs associated with Legionnaires' disease. What are those costs, and what are some of the most significant economic factors that you included?
Yeah, when we say cost, it is not just simply an economical analysis. It's not just that we want to know what is the cost, but cost is part of the decision. So it has a social important component, as we were also saying before. So we have to consider the cost as a kind of another measure that is used to compare different strategies, benefits and cost, advantages and disadvantages. And when you have a disease, you have at least two different kinds of cost. We define it in the model economic cost as direct and as indirect cost for Legionnaires' disease cases. Direct cost are those, for example, of remediation of buildings over the action limits. So those that were on the threshold that would have required an action that we have been using basically over 1,000 microorganisms per liter. And that is important because this action is to prevent Legionnaires' disease cases associated with those buildings. Economic cost then can be direct and indirect. And primarily are those for the Legionnaires' disease cases that are not prevented. So how many cases you lose that then will have a cost because you have to treat them. But these costs are complex because they include cost of hospitalization and prescription for Legionnaires' disease patients, loss of productivity, loss of wages for the patients, their family, and also for the caregivers during the sickness. And then there are also other kinds of costs that we have been trying to measure. For example, cost of lawsuit for the buildings owners that are associated with the cases that were not prevented. You have to consider that if you have a law that should protect people and somehow someone can get sick, so there was a law that was not respected. And this could, in some cases, open to trials and investigation to see if it is just an accident or if there are some kind of guilty components in that. Then we consider also the cost related to the loss of revenue from business shutdowns, office shutdowns during remediations. And that is very important too, because if you have a case, the first things that you have to do, whatever is the building, is to close it, to stop the use of it. This means that you have to stop the production if it is a company, but also the production of paperwork or activities if it is an office or whatever. So it is important to consider also this kind of cost. So the total cost at the end are direct, the building remediation cost plus economic costs that are the cost to the public, government, individuals, businesses, due to the need for remediation and to protect people's health.
I really did enjoy your paper. It's so thorough, and I want to make sure that the audience understands all of the things that you incorporated. You also looked at monitoring strategies, and which ones did you assume in your model?
Yeah, I can see that you not only went through the paper, but you got all the main points. I really hope to be able to answer enough clearly and to satisfy your question as well as the interest of the people that are going to listen or following our podcast now. Thank you again for this opportunity. Regarding the monitoring strategies, in the model, we assume that Legionella species monitoring would be performed by a kind of a standard regulation, which is the ISO 11731. which detects both Legionella pneumophila and some no pneumophila species rather than, for example, a non-pneumophila species specific protocol, as there are also of that kind. For a targeted pneumophila monitoring, we assumed that a culture method was a reference as a traditional use, whether it could be the protocol that you can find still in the ISO 11731, or the liquid culture method as the Legionnaires, which has been shown to have several advantages, not only in time, but also with a nice sensitivity. And these approaches can be used, actually are being used to specifically quantify the pneumophila, even regardless of whether any other species would be present in that water samples, whatever they would be more or less virulent. But from what we know today, the main danger, the main virulent pathogen still is the one that introduced itself in 1976 in Philadelphia, which is Legionella pneumophila.
How did water temperature factor into your paper?
That was a study line that provided some surprises. As you know, temperature is one of the levers that can be pulled to control Legionella growth, along with disinfectant, water age, water management, and so on. Our study specifically included building water temperature as a variable because it impacts on Legionella pneumophila and non-pneumophila species proliferation differentially. Indeed, Legionella likes to stay in warm water, so a little bit warmer. While we generally say the optimal temperature range for growth for Legionella overall is between 20 and 46 centigrades, Pneumophila's optimal range is 20 and goes all of the way up to 42 degrees. Whereas the non-Pneumophila species that has an ideal range that seems to go only from 1835 centigrades, a little bit lower. Since our model is based on calculation of the probability that Legionella pneumophila or non-pneumophila are growing in a given set of buildings, at least based on historical data, that water temperature change the probability that one or the other type of Legionella is present in the building. So that is a relevant parameter, but then there is a large overlapping in this range. So nature still goes over our capability to understand all the details of the biological phenomenon. But that, I agree, that is an important point, and the model includes the possibility to modify this parameter and show what would derive from the different simulations.
It really was fascinating to read all the things that you considered, and that really takes us to the punchline, which is maybe instead of looking for all species of Legionella, we should just focus on targeting Legionella pneumophila. What were your findings on that, and what should we be doing based on those findings?
Yeah, so the main question would be at this point is to focus on the main pathogen, on that pathogen and all its relatives, cousins, friends, and whatever. Before going through what we did, I want to make, if I can, a very, very quick comparison with what we did for COVID. So during COVID, in the tracing, we have been focusing, as well as in diagnosis, we have been focusing on SARS-CoV-2, the etiologic agent of COVID-19. But now everybody knows this is only one of the different viruses that include the large family of the coronaviruses. But at the time, we didn't focus on all. We focus on the main pathogen targeting that one. I mean, it's a completely different scenario, but it's not so different, the approach, because even at the time, we could have decided to look for any coronavirus. And even if the other, we knew that were the lower virulency, but we know that even other members of that group are have some kind of pathogenicity. So pathogenicity, even if lower respect to the one of SARS-CoV-2. So something like that would come back in the decision and the study that when we approach the question of Legionella species and Legionella pneumophila. We had then the wonderful opportunity to join literature data from on-field data by the collaboration with a partnership with an industry association, which is called Acqua Italia, which represents many water treaters in Italy, and who provided us with a lot of data on field. Actually, we asked also them to add some investigation to fulfill our need of data from real life, the operators on the field. They dedicated, therefore, time, and we are grateful to them, and a lot of expertise to the study, because they were interested in seeing data-driven, as well as their own anecdotal evidence to determine what monitoring and control strategy they should recommend to their customers. This is not only a cost-benefit analysis from a public health point of view, but also from a kind of industry point of view and commercial point of view. Water treaters are so often trusted advisors, particularly where there are not regulations or regulation which leave room for discretion. What the study demonstrated for the water treaters who worked with us in that monitoring and then taking action when Legionella pneumophila is not in control in a building is both a very cost-effective strategy and one that provides almost identical levels of protection for the public than doing monitoring and then having to remediation based on the results of testing of any Legionella species, both considering both approaches. But you can already understand that if you should act cleaning a pipeline whenever you find a Legionella of whatever kind would be clearly different than if you focus only on the pathogen. I mean, if you would trace all the coronaviruses, would be different than if you would focus on the SARS-CoV-2 during the COVID pandemic event. In fact, a more targeted Legionella pneumophila approach means water treaters and their customers can cover more ground with the same amount of resources. They can protect individuals in more buildings or more parts of buildings because they are not spending time and money remediating where it does not make much of difference, at least from what came out from our analysis, our simulation, and also from the epidemiological and science data, at least so far. Many water treaters are also interested in finding the right balance of remediation and public health protection because they are very aware of the heavy toll that full remediation take on the pipes and machines in buildings, shortening their lifespans, and then the use of chemicals that have also an impact for the byproducts that come from them. So there is also an impact on sustainability, on the green approach that you want to use, on the quantity of biocides that you will put in the environment. So the implications are related also on a One Health perspective, also sustainability, not only for that building, that those workers, but also for the release of contaminants as biocides into the environment. Therefore, it is important also in this case, to distinguish case by case, situation by situation. And it is important, as all guidelines show, to start from a wider risk assessment and then to define the most appropriate and the most individualized, personalized strategy for that situation.
Dr. Spica, do you predict a future where we're just sampling for Legionella pneumophila and then reacting to the remediation of just that one species?
Actually, it can be even a present. If the initial risk assessment would be done in a well-rounded way and would show how is the situation for water, as well as for the presence of all kind of Legionella in that water, and the transmission routes in that buildings, and the susceptibility of those hosts. So go back to the triangle: environment, host, and pathogen. It may be even today a useful and effective approach, and not only effective, but also efficient, that could protect people, provide information and preparedness to avoid cases, probably at much lower cost. Then it depends from building to building and from situation to situation, but I think it's not a future too far from here.
You mentioned the European Drinking Water Directive. I believe it was 2020-2184. What is that directive and how does it influence Legionella control strategies across Europe?
Oh, exactly. That directive is exactly based on a risk assessment approach. So, as part of this larger approach, it includes the possibility for each of the countries, European countries, then to identify the rules that better fits their own epidemiological scenario and the public health policy that would address their prevention objectives, targets in their own country. After talking to colleagues from university and public health authorities, also our study is opening a discussion and provide some evidences to consider this kind of a more focused approach.
The document we have here that most lawmakers use is ASHRAE's 188. That gets revised every so often. Is it your opinion in the next revision we should consider just looking at Legionella pneumophila and treating the water management plan towards that?
Actually, this is what we proposed. We are not an health authority. We are a group, not only Italian, actually an European, and not only European. There are also colleagues from other countries. We are proposing a kind of a white paper, white documents, providing all the original data and the reference database with all the documentation that supports the consideration of this kind of approach in possible guidelines or even health laws dedicated to prevent legionellosis in different countries. I want to remember saying this, that the target of public health is not to reach a zero risk for any disease. Even for COVID, we couldn't do that. Zero risk. It's only hypothetical, is an ideal condition. So what we have to do is to reach an acceptable risk, making it as low as possible and at the lower cost as possible. So it is very different if you are focusing a measure against toward in favor of a specific person, or if you have a public health view. If you have a public health view, you have to at least consider very seriously an approach that could be less expensive, and almost the same effective, because you have to consider that the increase in cost that we have monitored and simulated are at least over the 40% regarding the direct cost if you use the larger approach direct to all Legionella species, and the total costs are over the 27%. But this is with an advantage of, how can I say, the cases that you can prevent, of prevented cases, that is below the 2%. And you have to consider that all these numbers came out from a very conservative approach. So whenever we had to identify a parameter that would have been helping in supporting this final conclusion, we always have been choosing for the other. So we have been trying to put all the conditions to show that a targeted action on Legionella pneumophila could be not the most appropriated in a public health perspective for not hospital buildings, as we were saying at the beginning. But all our stressing of the model, all our tests always gave us a different result. So we have at the end to trust the results. And the results says that this is an appropriate, convenient, effective, and adoptable approach for prevention and public health.
We have both water treaters and policymakers that listen to this podcast. And one of the great things that's come from this podcast is now we've bridged the gap so those two can have conversations about things like this. So for all the water treatment professionals listening, what might you have them recommend to policymakers should they give them a call?
So let's make it as short as possible, as bullets, without going into the details that we said before, and I even probably spoke even too much on some of these explanations. So I would say, first of all, to make a good risk assessment. So that is the first. To make a risk assessment that is very individualized and would keep in mind the host that you have, the safety requirements that you want, and the starting condition of contamination or the historical data that you already have. And then, based on that, to focus as better as possible monitoring and surveillance. I think this can be probably a point that can summarize all we've been saying, but also provide some practical hints in the risk assessment step that every operator knows, and there are several guidelines all over the world in different countries to set it up, and that are also present in the 2020 number 2184 European Directive. So that is the main point. And then a note for the environment. I mean, we have also to keep in mind that if everybody would distribute in the water a lot of biocides, then we will get a lot of derived products, combined products, and then we'll go in the water and all over, making problems that are not only related to that building or that city, but they involve a One Health perspective and a planetary health perspective. So sustainability. I don't know, another point, maybe start from the epidemiology evidences that you have in your local area. Check those. Verify if there are outbreaks, periodic outbreaks, or if there never been a case, or if the pathogen was a microorganism of a species or another. And in the end, the purpose is to be to save as many people as you can from the Legionellosis, Legionnaires Disease, but do that as well as you can afford it.
Dr. Spica, if listeners want to learn more about your research, what should they do?
Oh, yes, thank you. I would love if operators and the researchers would join this study and would help us in improving it. So I welcome everybody to, first of all, to consider our results in a paper that has been published on water, and you can find in a link that I am providing. And also here you will find a special issue that I decided to open as editor of the One Health section of water. And I would invite to submit your manuscript and most of all to participate to the discussion. Indeed, this is definitely finding and an achievement, but the model and its results, most of all, represent a starting point, and it will go as far as possible with the help of everybody. So very welcome, and thank you for this opportunity. I hope colleagues and also managers, operators would consider the study and would participate in growing up this research line. Thanks a lot.
Well, Dr. Spica, we'll make sure to have all of the resources you provided to us on our show notes page. I want to thank you again for coming on the Scaling Up H2O podcast. Your paper truly was fascinating. Scaling Up Nation, I highly recommend that you read it. I think you will be glad that you did. And once again, Dr. Spica, thank you for coming on the Scaling Up H2O podcast.
Thank you very much. It's been a great pleasure. And I say bye-bye and arrivederci to all those listening to this beautiful podcast. Congratulations, Tracy. Thank you.
Once again, thank you, Dr. Spica, for coming on the Scaling Up H2O podcast. And also a thank you to Patsy Root for introducing me to Dr. Spica. Nation, I was fascinated with that interview. And Dr. Spica shared some resources with us. We, of course, have those on our show notes page. So simply go to episode 435, navigate to our show notes page, and we're going to have all of that information for you. Of course, you're also going to find a discussion guide there. You're going to find that for every episode that we do this year. And that is made for you to listen to this podcast and have conversation with your colleagues. I think this will be a tremendous conversation for you and your colleagues. So please go to scalinguph2o.com and download that discussion guide. I just thought that this was a fascinating interview all around the importance of Legionella pneumophila and focusing on Legionella pneumophila rather than all species in a non-hospital setting. Things that were challenging on how we've done, looking at what we should do in the future. The cost effectiveness of targeting Legionella pneumophila instead of other species when it comes to public health. And then the overall risk assessment of what we've learned in previous water management plans and strategies. I just love that we're taking what we knew and now we're challenging that. We're trying to figure out how we make things better, how we make things more cost effective, how we make things more executionable. And folks, that's what we do. We do our jobs, we get information, we figure out what that information is telling us, and then we're constantly asking ourselves why. Why do we do it this way? Why do we continue to do this? What if we do that? Now, maybe that's around water management plans. Maybe that's around how you run your test. Maybe that's around how you write your service report. Maybe that's around how you plan your day. We're constantly challenging the status quo to see if there is a better outcome out there. That's why I love this industry. That's why I think water treatment is the best industry out there, because we get to do stuff like that and we get breakthroughs because we are thinking that way. Well, Nation, I know we spoke about a lot on today's episode. As I mentioned, we're going to have more resources on our show notes page, and we have resources on every single episode that we do. Specifically, lots of information this month came for Legionella Awareness Month, and you might be saying, what's the next step? Well, we tried to make that easy for you. We tried to put everything that our guests have given us on our show notes pages. We're also updating our Legionella reference pages, our resource pages. All of that is for your grabbing pleasure, and you can now read all the information. You can figure out what your next step is. And once again, our call to action this month is making sure that we are learning something new, and we're scoping that around how do we have better conversations with our customers so we can ultimately get them to make better decisions. Nation, I sure appreciate you hanging out with us each and every Friday or whenever you consume this podcast. By the way, we get so many Scaling Up Nation listeners that will share with other industrial water treaters how to sign into this podcast on their favorite podcast platform. And then we get a new member of the Scaling Up Nation. So as I mentioned earlier, we do those buttons so it makes it easier to break the ice at conferences. Well, another way you can break the ice to a complete stranger is ask them, did you know that we have a podcast called Scaling Up H2O, and it's all about industrial water treatment? While you're driving from account to account, you can learn all this cool information and have access to all these great guests. And you can do that by simply adding Scaling Up H2O to your favorite podcast player. Now, maybe somebody says, podcast, what's a podcast? Now, that's a different conversation. You need to explain that with them, but I promise you can have that conversation. And then you get to help them download whatever your favorite podcast player is. And the first thing that you are going to subscribe to is the Scaling Up H2O podcast. They will have access to well over 400 episodes for their listening pleasure. And every single time a new episode comes out, they will be notified and it will be right there for them to listen. They will be so grateful that you told them about that. And what a tremendous icebreaker. Nation, I hope you're out there. I hope you are meeting your next new person that you can share information with. And I hope you tune in next week for a brand new episode of Scaling Up H2O. Are you ready to take your water treatment career to the next level? Get the confidence you need to sign up for the Certified Water Technologist exam today by taking our Certified Water Technologist prep course. Learn valuable tools and techniques to help you succeed. Plus, test your knowledge with our 100-question practice exam. Visit scalinguph2o.com/CWT prep and put yourself on the fast track to certification. Don't wait, start today.